Adrenergics. The sympathetic nervous system controls how energy is used in stressful situations, and the key drugs here are norepinephrine and epinephrine. It's part of the fight or flight syndrome. Adrenergic agonists, which are also called sympathomimetics, will cause the pupil to dilate, the lungs and bronchi to dilate, the heart rate to increase, the blood vessels to constrict, although occasionally some of these drugs will cause them to dilate, stomach relaxation, bladder relaxation, and uterine relaxation. Alpha adrenergics primarily cause vasoconstriction and central nervous system stimulation, whereas beta adrenergics will cause bronchial, GI, and uterine smooth muscle relaxation, glyconeogenesis, that means making more sugar, taking the stored sugar in the liver and making it available to the rest of the body, and cardiac stimulation. The dopaminergics will cause renal, coronary, and cerebral artery dilation. Again, drugs in this category of the adrenergics include norepinephrine, epinephrine, dopamine, and albuterol. How do these drugs help in the fight or flight? Norepinephrine affects the central nervous system. Specifically, it increases attention unless the stress is too high. It increases a person's ability to pay attention to a potentially life-threatening incident. Stimulation of alpha adrenergic receptors on smooth muscles results in the vasoconstriction of blood cells. This is the body's way of shunting blood to where it is really needed, meaning the brain and other vital organs. Stimulation of alpha adrenergic receptors on smooth muscles results in relaxation of GI smooth muscles. What does that really mean? Well, if you relax these muscles, you don't have peristalsis, or you don't have very much. Food is not getting moved along. It's being stored within the system. First of all, that makes it a potential source for every possible calorie that can get sucked out of it. And second, in survival out in the wild, if you are under attack or potential attack, you don't have time to sit down and go to the bathroom. So this gets rid of that particular urge. Stimulation of these adrenergic receptors also causes contraction of the uterus and the bladder. Why is that good? The bladder, contraction of it, empties it out right away, so you don't have to worry about it anymore. You can get on with running away or doing whatever you're doing. These alpha adrenergic also cause contraction of the ciliary muscles, which actually dilates the pupils. Why is that good? You can see better. You can focus better, especially under low light conditions. Remember, your body sees this as a near emergency, so you need to be able to visualize as good as possible. There's a decrease in insulin release with these drugs. Well, if you have a decreased insulin release, that means more blood sugar. Your blood sugar is higher. It's not being carried someplace else. So it's available maybe to be used later if you need it. Now we're looking at stimulation of the beta-1 adrenergic receptors. They result in cardiac stimulation. So we've got increased contractility, increased heart rate, and we have increased conduction throughout the heart because of these drugs. Now, stimulation of the beta-2 adrenergic receptors causes bronchodilation. That's more oxygen in, that's more air that can flow freely in and out of the lungs. Better oxygenation of the lungs, better able to do either your fighting or your flighting. The beta-2 adrenergic drugs are also associated with glycogenolysis in the liver. The glycogen is getting broken down, becoming sugar, so it's available to the body. There's an increased renin secretion by the kidneys that again is associated with regulating blood pressure. And we've got the dopaminergic drugs within this classification, and that's basically dopamine. Why is it used? What is it good for? Well, this is your biggest fight or flight drug. It causes renal, coronary, and cerebral artery dilation. That gets the blood where you really need it. You really need it to the brain to be able to make life and death decisions. You really need it to the heart to keep the heart going, and you need it to the kidneys to keep the fluid level appropriate and keep up the blood. It's got a major issue in the blood pressure. So why do we use these drugs? Bronchodilators for asthma and bronchitis is a big use. Quite often they're used in the eyes, both in treatment of open-angle glaucoma, in dilating the eyes. That's what happens when you go to the eye doctor and they need to look inside. They'll use these drops in the eyes to open up so they can see the inside of the eyes, and also for treatment of red eye. It's in many of the nose sprays that are out there. It's a topical. It's going on the nasal mucosa. It constricts the blood vessels, thereby decreasing the swelling that's going on in the nose and decreasing the congestion. These drugs are used to support the heart during cardiac failure or shock. So what's the bottom line with these drugs? They keep the heart working under stress. They get the blood where it really needs to be in emergencies. They facilitate the flow of oxygen into the body. They regulate the blood sugar. They keep it coming. Remember, glucose is your primary source of energy, and you need energy in times of stress. And they slow down all the non-essential activities in the body, things that are not needed in emergencies or are not needed in times of stress. Adverse effects? Well, for the central nervous system, we can have headaches, restlessness, excitement, insomnia, euphoria, tremors. Remember, these drugs stimulate the central nervous system, so all of this makes sense. All this follows with increased stimulation. Cardiovascular, when we get too much of these drugs, we can end up with dysrhythmias, palpitations, tachycardia, vasoconstriction, and hypertension. And for other adverse effects, we might have a loss of appetite, dry mouth, nausea, vomiting. Tastes may change, but that's not real common, and we might see sweating and muscle cramps.